Hello everyone, I'm Celine. I'm an infection prevention practitioner and I'm part of the social media team of the Hospital Hygiene Congress 2026. And I'm joined today by Mark Garvey, who's a consultant clinical scientist in microbiology and the director of the infection prevention team in Birmingham hospitals.
Yeah, no, thank you.
Thank you, Mark, for joining us. I would like to ask you, as being part of a big fan of Pseudomonas aeruginosa, I think you're also a big fan of water pathogens spreading into hospitals. What are for you the main changes we have to make toward a water safe care in hospitals?
No, yeah, thank you for inviting me. Thanks for the question. So for me, it's really understanding the importance of water and water safety and the role that water safety has in the healthcare environment. I think for me, it's really understanding how we can get spread of organisms of the water and then trying to make it as safe as possible for our patients. So I think really it's getting people on board with this concept of water safety and what things we can do to make our patients safe. So really, yeah, the key thing for me is understanding the importance of water safety.
Okay, and do you think there are any simple low-cost interventions that we can apply into daily practice in order to prevent any infection related to water
I think,
pathogens?
Margaret Voss will talk a little bit around it. Simple interventions, for me, is looking at like the sink splash zone that I talked about. We know that water splashes around 2 meters away, and then it's thinking, simple intervention could be put like tape around the tap within two meters and say, actually, no patient equipment goes in here. Something simple like that. If we can't, do fancy interventions, we could do something simple like that.
Okay. Well, thank you very much for your intervention. We are pleased to have you with us in France. And thank you everyone for joining us. Stay tuned for the next interventions.
Thank you.